From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is affordable health care is available for everyone in the U.S. In 2010, the Affordable Health Care Act was signed into law and upheld by the Supreme Court in 2012. Its goal is to give more Americans access to affordable, quality health insurance and to reduce the growth in U.S. healthcare spending. It also requires all Americans to be in an ACA-compliant health insurance plan. And in a move we are used to today, the ACA Open Enrollment period this year is November 1, 2015 through January 31, 2016. Consistent with Bon Secours SQP goals, we are dedicated to helping people in our communities identify low or no-cost health insurance coverage through programs such as Medicaid and/or the Health Insurance Marketplace. But wait, don't confuse this open enrollment period with Bon Secours Fall Open Enrollment. This program is designed for those who do not have a health insurance plan through any other means. So, if you are a benefits-eligible Bon Secours employee with existing coverage, this does not apply to you. But you may know someone it does apply to. So to assist folks with finding the best coverage for them at a price they can afford, Bon Secours is taking action. How? Through our patient advocacy partners. Patient advocacy partners are locally established patient advocacy organizations that can help those without health care insurance get health care insurance. But they can actually do more. Our patient advocacy partners can help anyone determine if they are eligible for no or low-cost insurance coverage, as well as help them with the enrollment process. And if someone doesn't qualify, our partners can assist in selecting a plan that is best for them from the health insurance marketplace. Individuals or families who purchase health insurance through health insurance marketplaces or the health exchanges are eligible for tax credits under the Affordable Care Act. So, if you know someone who does not have health insurance, or if you suspect a family member or friend does not, gently break it to them that there is an answer. They can get help, and here's how. On the screen, you'll see a listing of Bon Secours patient advocacy partners in communities we serve. Contact the patient advocacy partner in the appropriate state of residence and get the help needed today. If you need health insurance or know someone who needs health insurance, Bon Secours can help. Contact the Bon Secours patient advocacy partner listed in your state today. And remember, enrollment only happens between now and January 31st, 2016. In other news, we are working our way through the new Bon Secours core competencies. There are 10. Today, we want to talk about 2 core competencies that relate to our organizational capability, ministry, leadership. But before we go there, let's talk a little bit about how to find more information about the Bon Secours core competencies. We think the best way to find documentation on the Bon Secours core competencies is through IRIS. So first, go to IRIS and look for Talent Management in the drop-down list of the Human Resources tab on the BSN Welcome page. Then find the Resources section on the Talent Management page and look for the BSN Competency Model link. Under that category are a number of documents that help explain the Bon Secours core competencies, including behavioral expectations, frequently asked questions, and a model fold-out document which is available for printing. So, we know there are 10 core competencies that when combined with our own technical competencies, we get to our organizational capabilities. Now, our organizational capabilities help us achieve our strategic quality goals. Fair enough. The core competencies we want to talk about today fall under our organizational capability, ministry, leadership. And most of us understand that BSN responds to the call to care for those in need, especially those who are most vulnerable, in a way that reveals God's compassion, healing, and liberation, and a commitment to care for body, mind, and spirit. How do we do that? Well, through 2 of our 10 core competencies. Demonstrates love and care in all human-to-human interactions, especially with those who are most vulnerable, and interacts with others with an attitude of service built on trust and the spirit and values of Bon Secours. Now again, you can get greater detail on what that means and behavioral expectations on IRIS, the Bon Secours 10 core competencies, our roadmap for strategic success. Finally, Bon Secours Hospital Baltimore has been named as one of the greenest hospitals in the nation by Becker's Hospital Review. Gone are the days of simply healing sick people. Today's Bon Secours hospitals take on entire communities. How? Well, one of the ways is by reducing our environmental footprint. And Becker's Hospital Review says Bon Secours Baltimore is one of the 50 greenest hospitals in America today. By the way, Bon Secours Hospital Baltimore is one of only 5 hospitals in Maryland to make that list. To develop the list, Becker's team conducted research and analyzed sustainability information from sources such as Practice Green Health, Healthier Hospitals Initiative, the U.S. Green Building Council's Leadership in Energy and Environmental Design program, and the Environmental Protection Agency. Of note in Becker's final report about Bon Secours Baltimore Hospital was that Bon Secours is one of only 10 hospitals in the country to receive Practice Green Health's Leadership Circle of Excellence Award for 2015. Please join us in congratulating Bon Secours Baltimore Hospital for this prestigious recognition as one of the 50 greenest hospitals in America. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.